Okay, we're going to call this meeting to order. Roll call, please.
Scott McClory,
Here.
Ron Dunwoody,
Here.
Gary Payson Jr.
Here. And our only item today is discussion and possible decision regarding employee health insurance plan for 24-25 plan year.
Good morning. Appreciate everybody meeting with us this morning. As you saw in my memo, I should say is the memo that Casey and I worked on, our annual health insurance plan year runs from July 1 to June 30th. So we're getting ready for that renewal. And obviously too with the PD bargaining for this year that we have to do. This is a topic that we have to get some sort of guidance on as we try to move forward, and budget season will be here very soon. We'll be starting that in the next month or two. So this is a topic that we have to talk about now. And as you saw in the memo, and this doesn't really come as a surprise, the city's health insurance costs have been increasing significantly since 2021, averaging about $280,000 a year in terms of costs. And as the council knows, the city's levy has not been increasing by nearly that much. And of course, that's, our levy increases have to cover more than just the health insurance costs for employees. Obviously, there's, costs for services and other personnel costs and equipment and maintenance, all that kind of stuff. So it's just something that's been increasing as an expense. And for budgeting purposes, it's something that we, we have to somehow figure out how to close that gap. We've got some information which we'll show you here momentarily, explaining just what that issue is. And I want to give Casey a lot of credit. She's been doing a lot of research the last 3 or 4 months, putting together this slide presentation. Casey's reached out to other communities to find out about what their premiums are, as well as she's contacted multiple health insurance companies, as well as gotten information from the state. So the goal is to give you guys as much information as possible, just to, in terms of what those options are. So with that, Casey, if you want to.
All right, good morning. So looking at the presentation, just to give you some background, of course, the city is self-insured. Our claims, and as Adam was just mentioning, and overall costs are continuing to rise each year, much faster than growth in levy and other revenues. We have historically high interest income, which has helped sustain the budget. And the city has also helped sustain budget by allocating less of revenues to capital funds and increasing borrowing for capital projects. We've previously relied on extra funds to mitigate our increase in costs in 2024, which included supplemental state aid and interest income. I don't know if you wanted to add it to any of that.
Yeah, unfortunately, our health costs have been exceeding, like I said, what we've been able to pay for out of the levy. And so, the city has been able to somewhat cover those costs, at least since 21, in large part due to the rising interest rates and getting a better deal on our deposits with Associated Bank. So as you can see, I mean, since 21, we've gotten a lot of interest income, but with the Feds predicting that they're going to cut interest rates in the future, that number, if it goes down, obviously is going to create a hole in the budget. So that's partly why this is another timely conversation. And as Casey also said, that the supplemental state aid we got this past year helped. But again, that was a one-time increase from the state. It is going to continue to grow at the growth in the sales tax, but it will not be a huge number every year. It's certainly not going to be a one-time $250,000 increase. And one other thing too is we also benefited, at least with respect to levy. That increase in levy revenues number you see of $169,953 per year as an average over the last few years is artificially high because we used some excess levy amount that we had not used in prior years. As the council may remember, we had some of that unused levy from the prior 5 years that we were able to use, as well as some of the extra levy revenue that was approved as part of the fire referendum was helped use to cover some of the fire costs. So that 169 number you see is even higher than really truly the levy increase could have been under the levy limit, but for those sort of unusual circumstances. So that's just another reason why the revenues are not keeping up with some of these personnel costs.
This is a new slide that we added since the packet went out. And Adam, I don't know if you, I'm sorry, the number pieces I'm going to pass along to Adam to speak to.
Yeah, and this is something that Corey put together. So thank you, Corey. This is really helpful. This was also just to help illustrate the impact, the challenge that the health insurance fund has had since 21-ish in particular. You can see that it peaked in about 2019, and this is as of December 31st, 2019. The health insurance fund had, cash in hand had almost $1.5 million available. And then you can see that balance has decreased every year since then. And this is just, again, showing that the city has been not adequately being able to cover the health insurance costs. Health claims in particular last year were much higher than expected. And so this is part of the problem. We really need to make sure that we have adequate cash on hand in order to cover those claims. This is something that we just spoke to our broker, or not broker, but our third-party administrator with yesterday. And this is something that they were emphasizing is really important to make sure you have enough cash to be able to pay the claims out, because we are a self-insured plan. If we don't have the cash, then obviously we get, as the claims come in, we can't pay them, which is going to be a problem. So part of this conversation is not only from a budgeting perspective, but also making sure that we're budgeting enough that we're able to sustain, a healthy amount of cash in that fund, so that we don't continue to, have losses every year.
All right, and just a little bit more background here. So with how our plan currently stands, we cannot continue to sustain the increased costs. We currently have 88 employees on our plan. Of those, 65 are enrolled in family coverage and 23 are employee only. Our plan renews on July 1, and as Adam mentioned earlier, we want to take into consideration that the police contract will be renewing in 2025. So these are just some more slides showing our numbers. This is our calendar year claims and total costs from 2019 to 2023. So as you can see, our costs have just continued to increase. And then plan year, our paid claims through 2012 through 2024. And as you can see, that's just continuing to trend upwards. These are our current plan details. We have a very good plan for our employees. Our deductible and out-of-pocket max are relatively low compared to other communities. We provide the HRA, which is $500 for single and $1,000 for family. Employees are able to roll over 100% of those funds into the next plan year, up to a maximum of $4,000 per year. Currently, our police have a lower amount for those annual contributions. We also have an FSA, so these are the employees can put in their own pre-tax contributions to these accounts. We have a healthcare FSA and a dependent care FSA. And then the city, of course, currently covers the full share for the premiums. So overall, our total city expected cost with these numbers is $2.8 million. So then we'll get into some options of what we could consider. The first option would be to just modify our current plan. Some possible changes that we could look into, which would involve either all or some of these, would be to add a monthly premium. What that could look like, we have different options. We could add a premium for all employees. We could keep it as no cost to our employees, but add premiums for spouse and dependents. So what I oftentimes see that looking like is they will have an employee-only tier, employee plus spouse, employee plus children, and then full family coverage. Or we could add add a premium per dependent. We could also change our plan schedule, meaning we could make a change to the deductibles, co-insurance, out-of-pocket max. We could add a second plan option. What this would look like is we would have two plans that the employee can choose from. One that would be similar to our current plan, but it would have a premium for them. The second option would be a high deductible plan. So it's not as good of a plan, but it would have a lower or no premium cost to the employee, so they could have a choice there of what they want. We could remove or reduce our HRA reimbursement. Again, currently single employees receive $500 per year and families receive $1,000 per year. We could consider, if we reduce our HRA benefits, perhaps increasing the FSA amounts that employees are able to put into those accounts. We could add an opt-out incentive. This would be the city paying our employees to not be on the plan. So I worked somewhere previously that had this, and for example, we could pay, if an employee were eligible for single coverage, $30 per paycheck. If they were eligible for employee plus spouse or child, $50 or $80 per family. Those were just, it could be, the amounts could be anything, but just trying to encourage maybe some employees to consider other options, and maybe that would make them want to go into a spouse or parents or whatever's plan. And then we could also consider working with another broker or maybe a TPA to potentially save costs. I have been in gathering data for this, working with a couple of brokers to get some quotes, and a couple of them thought perhaps looking at other options as far as working with them or changing to another TPA could reduce our costs if they were working with us. So those are some options we could look into as well.
The only thing on that is, you know, you're looking at potentially, let's say you could save $40,000 by changing to a different broker. So it's not, you know, in terms of the scope of savings, it's not going to solve the entire problem, but there's some things you could do on the edges to save money. We might be able to get a better deal more on the third-party administrator. We don't have an estimate yet on what those savings could be, but in terms of the broker changes, it wouldn't be a real significant long-term savings.
So looking at some of those options, this slide also updated yesterday. As Adam mentioned, we had a call with our TPA, so he provided preliminary numbers as to what our 2025 renewal will look like. So these are the preliminary expected costs. These could change. But if we were to impose a 5% premium of the total expected cost, you can see what the total savings to the city would be at the bottom. If it were 2.5% expected cost, you can see what the estimated savings would be again at the bottom. If we were to make changes to our HRA, we have a few options here. In the packet that was originally sent out, I had the reduced HRA option, which would just be cutting the current HRA in half, essentially. So it would be $500 for family, $250 for single, or removing the HRA altogether. We added a third option in here, which would be to still give all of our employees an HRA instead of removing it, but keeping that at just $500 flat instead of having an increased amount for family. And then the opt-out incentive, I added that in there. That's hard to estimate how many employees, if any, would want to select that option, but there could be potential savings there as well. So some pros and cons of keeping our plan, but just making changes to that would be remaining on the same plan means that employees do not have to change networks and providers, so there's going to be really no disruption there. Remaining self-insured allows us to keep flexibility with our plan design. And from what I see, I think employees are happy with our current plan. I don't receive complaints about our coverage or anything like that. Cons, adding a premium, of course, is going to upset employees that are used to the current benefits. If we add a premium for dependents, of course, employees are going to be upset. Currently, having a $0 premium is a really great selling point for recruitment. And the city assumes the risk if claims exceed projections or if there's a catastrophic event. So now moving on to a second option, which would be enrolling in the state plan. With this program, the city chooses what our program option is, and then from that, the employees get to select their plan. So I'll kind of go over that in more detail on the next slide and what that looks like. Some points to this. the employees, each plan has a limited network and there's a difference in cost. The city pays 88% of the premium based off of the lowest cost carrier. Employers may join on the first of each quarter, and it can take up to 4 months to get enrolled in the state plan. So at this point, we would be kind of behind the ball if we were planning this for July 1. I don't know that it's out of the question, but it does take some time. So, so this is what the program and plan options look like. The program option comparison is where the city would be making a choice. So we would have the choice between a high deductible plan, their local program option, the deductible program option, and traditional. As you can see, the better the program, the more expensive the premiums are going to be. So with the traditional program, it's a really great program because there is no deductible. Essentially, the employee is paying their premium. There are some costs, some of the like cochlear implants and things like that, some of the medical devices employees would have to pay for, but beyond the premium, they're covered. However, you're going to see that cost on the next slide, which is a little surprising. The high deductible plan, their deductible is going to be higher than our current plan and the out-of-pocket max, but you can see just some of the differences here. The pharmacy benefits are the same on all of the plans, and then the plan options are listed here. So these are the plans. Once we choose the program, the employees get to pick from these 4 plans, which are Dean Health, Mercy Health, Quartz, and Access Plan. I feel that most employees would want either the Quartz or the Access Plan, as you can see based off of some of the major health systems that are in each of these networks. Dean and Mercy are extremely limited, but those are the most affordable for the employees. So not really great options. If you go to the next slide, these are the monthly premiums. So the premiums, again, are going to depend on which program we pick. So if we're looking at the high deductible program, which is the green table there, that is the lowest cost option. If an employee were to choose the Mercy Care plan, you can see the max share is $84.67 per month. So that ends up being $39.08 per paycheck for the employee. But they have that Mercy coverage, which really isn't giving them a lot of options as to where they can go. The high end here, if we were to look at our traditional program, if that's what we selected, and the employees, say, went with the Quartz plan, which has Aurora and Pro Health, the least amount they're going to pay is $259.24 per paycheck. So although they don't have that deductible, they're paying a huge premium per paycheck.
And just to sort of emphasize what Casey's saying about, realistically, when looking at this chart, quite frankly, the Dean Health Plan and the Mercy Care Health Plan just aren't realistic options because there aren't any providers in the networks that are anywhere, close to this area. So realistically, the employees would be, have to pretty much choose between Quartz Central or the Dean Access Plan, which, as you can see, are very, very expensive plans. So.
So some pros and cons here. Pros, the risk is spread across the group. We would have cost certainty, so we have fixed premiums for the year. There's uniform benefits, so all plans offer the same medical benefits, meaning whatever program that we choose from, whether it's the traditional, the high deductible, whatever plan the employee chooses, their benefits are still the same because of the program that we selected. They're just going to have a different network, either a very limited one or more expansive depending on what they choose. There is a wellness program included, and we could still offer an HRA or an HSA if we elected the high deductible plan. Some cons, again, the risk is spread across the group. So with the brokers that I've been working with, they informed me that generally the groups that are joining the state health plan aren't performing very well. So it's not a great pool that is involved with the state plan, which is why last year their premiums increased by 14%, and they anticipate that they're going to be increasing again because people are starting to pull out of the state program. There is potentially a high surcharge for the first 2 years, depending on the outcome of the underwriting steps. So once we go through the underwriting and they determine how our group is performing, we could potentially see a surcharge there. One of the groups that I reached out to said this was over $400,000 per year for the first 2 years for them due to the outcome of their underwriting. ETF can be slow in processing life event changes. So if somebody has a baby or they get married, if they need to get new cards or anything like that, there's generally a delay because the state is handling that instead of myself directly connecting currently with our TPA. If employees encounter issues, they must contact ETF or the carrier themselves. So I'm not going to be able to help them at that point because ETF isn't going to talk to me and help me with the employee. They're going to say the employee has to contact me directly. So I'm not going to be able to assist them there. Again, higher premiums, less control over the plan design. Other than picking our program, we can't decide, well, we'll pick this program but lower the deductible. It is what they tell us it's going to be. And then again, the health plans have limited provider networks.
So in summary, the state health plan has some very, 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 very significant negatives to it. It's high cost and limited care. So just to summarize that option.
And then finally, we could choose to enroll in a fully insured plan. So I have a couple of quotes that I received. The first was from the Dean Health Plan. They have 3 different networks. So they have a HMO, which is their very narrow network. So as you can see, for primary care providers in Walworth County, we have Whitewater, Darien, and Delavan. So not great choices here. And this is the rate sheet. They also have the point of service. This is kind of an option that includes both the HMO and PPO options. So although employees could go to out-of-network providers, they do need to have a dedicated PCP, and then that person would need to refer them to any specialists or anyone outside of the network. So there's still limitations here. And then our rate sheet. And then the PPO, which is why I reached out to them because I was interested in their PPO option. This is the preferred provider plan, and you have a wide access of providers. However, for members that are not that are residing in a light blue area are not eligible for the PPO product. So although most of our employees do reside in Walworth County, we do have employees that do not. We have firefighters that are in different areas. Myself, I'm in Waukesha County, so I wouldn't be eligible for the PPO. So we do have employees that wouldn't be eligible for this network. So the quote from Dean Healthcare would be approximately, now what they gave me, we would still need to go through the underwriting process, but this would be potentially 6% of savings in our first year. They informed me that some of our employees, well, of course, are not eligible for the PPO plan, as I just mentioned, but also for the plan to perform well over time, they informed me that we would need around 20 of our PPO eligible employees to also select the HMO plan. So this isn't a great option for us to ask 20 of our employees to enroll in that very limited network. Some other things to consider, Dean will only cover claims incurred after July 1st of the effective date, so the city will be required to fund claims and pay administrative fees for claims incurred prior to 7/1, which would be the same for any fully insured carrier that we would be enrolling in. And then, again, rates are subject to underwriting review. And then we have quotes from UHC, which is United Healthcare and Group Health Trust. These plans, they all tried to maintain kind of our current, they tried to give me what our current structure is. So with this, our current annual costs are 2.8, as I mentioned earlier. The UHC costs would be potentially 2.3 with a cost savings of $450,000. With this, we could add an HSA plan for additional savings. But when I was working with this broker, I asked, I know we would have savings in the first year, but what would we expect to see in the second year? She said, I tell most of my clients to expect a 15% increase each year. She said with UHC, it's generally around the 9%, but she said that's standard, so every year it would be around this 9% increase. So I don't know that that would be cost effective for us in the long run. United Healthcare, of course, is a very broad network. For the first year, they will give us an 8,800 wellness credit to help promote wellness, so it can be used for wellness types of expenses. And then UHC will also give employees a $300 Visa card if they, I think it was completing like a biometric screening, so there is something they would need to do in order to get that $300 savings. Some pros and cons of considering these fully insured options. Pros, insurance companies assume all the financial risk. There is cost certainty because we'll have fixed premiums for the year. And there would be some additional benefits, as I mentioned, like that wellness program. Cons, we have less control. There's limited customization to the plans. Higher premiums, rate hikes, we're likely to see premiums increase over time, and we do not have control over that because we're now in a pool with other groups. And as I mentioned with Dean, the city would need to cover a claims runout period with Consociate, which would approximately be $420,000. It's also difficult when I was working with these brokers going to fully insured, and then if we ever did want to go back to self-insured, there's difficulty in going back. And then lastly, I just gathered information from some other local municipalities. So looking at Lake Geneva, Delavan, Whitewater, you can see that all of these do charge currently a premium for their employees. On average, $125 for single. And then our plan, I think, is very competitive compared to what we have listed here.
And just, it's something, oh, can you pull it?
Yeah.
So, employee recruitment and retention is obviously a major concern and something that we're focused on and want to continue to focus on going forward. And, everybody knows with, inflation and the pressures that employees are feeling, that it's something that is a priority. It's tough because unfortunately some of our employees see what other communities are paying, and they'll come to us and say, oh, the city of, Delavan, I see an advertisement for this position and it's, $3 more an hour than what our position is offering. Well, the problem is Delavan, as you can see, charges very, high premiums for their health insurance to the employees, in part because they're on the state plan. So, I mean, you can see a single employee could be paying between $100 and $450, or between $119 and almost $570 a month in premiums. And that isn't reflected, obviously, then when they get the offer, when they're looking at wages and what's going on in the job market. It's true that our health insurance plan is a selling point, and I think it's valued by the employees who are here, generally speaking, but I think sometimes it's tough for them to understand the value of it from a dollar and cents perspective, because they're seeing what the wages are being advertised for. And certainly when we're recruiting new people, again, these dollar amounts don't necessarily, are tough for them to provide a monetary value to for an hourly wage perspective. So this does just make it somewhat tough for us when you're trying to compare our wages and others from just an apples perspective, because we're incorporating the full 100% of the health insurance costs, and so it's as a result, our wages aren't necessarily as high as some other communities, because the other communities are passing along such high insurance costs to their employees.
So with that, I'm happy to answer any questions or.
So on that note, have you done any studies comparing if we raised everybody's wages, how it's going to offset what's better, going with our current insurance plan or switching and giving everybody raises? Have we looked at that? So then you can do apples to apples.
Yeah, I mean, we could certainly raise wages. We'd have more flexibility to raise wages if you start incurring or if you start spreading some of these health insurance costs to employees.
Right, and that's what I'm asking. It's like, look, okay, so say for example, at Delavan, I make $30 an hour, but I'm paying X amount in insurance. Here I make 20 bucks an hour. What is the insurance cost? Plus my salary. It's total package. What is the total package comparison, apples to apples? I think we really need to know that. So you can say, hey, at Delvin, you're paying $95 a month. Here, you're not paying any, but you're over there, you're making this versus this. What is the total cost?
And I'm gonna use Delvin, for example. I mean, if you're on the Delvin family plan, you're paying $570 a month, and let's say you work 160 hours over that month, that averages out to $3.56 per hour. So, if you add that to our, you could use that as a comparison to add.
But I think I'd like to dive in further is comparison of another city or another plan. Again, you want to look at everything. So if we decide to go one way, you have to be able to explain this to the employees. Look, this is what you're saving by being here, or this is what it's going to cost you. We got to have a total benefits, total salary, total comp cost of what's involved, so you can compare what is going on. Because if we say, okay, we want you to pay $15 a paycheck or whatever one of the premiums that we've looked at, if we stay with the self-insured, what is it going to cost the employee to stay versus leaving?
And I think honestly, I think this is gonna be tough to calculate because of the fact that every community's got completely, I mean, you're gonna factor in, you got dental, you got vision, you've got life insurance, there's an infinite number of employee benefits that not only we have, but that other communities have. So, and then you're trying to, I just don't know how you really.
Are any of these self-insured?
No.
They're all through a plan.
Yes.
Is there anybody else in the state of Wisconsin that's self-insured that would be something to compare against?
I think like Geneva was self-insured. We can compare. I think that it's going to be hard salary-wise and time-wise doing like a compensation study by myself, to be honest, and for our full pool of employees getting all of their salaries and trying to compare this. And I don't know how quickly or forthcoming employers are going to be with the other benefits that Adam mentioned that they're paying for, and like how much that costs, what their broker costs are, TPA costs are. So while I can gather some salaries, it's going to be, I don't know that I have the power to get all of that information as timely as we need to start making some of these decisions. I can get some general feedback, absolutely, but I don't know how on point it will be, especially I don't know actual salaries versus what their salary ranges are that they're going to send to me, and it would be extensive to try to compare apples to apples as much as we can.
Well, and this is part of the reason why, doing a comp study would be helpful so that we can have, we did the best we could a few years ago to try and get some comparative and looked at some of the wage studies other cities had done, but, having a comp study would certainly help because we just don't have an updated one. And another thing too is the case you said about for benefits too, you also have to look at, vacations have a value, PTO has a value, the medical leave bank has a value, like all these things have a value. So again, trying to quantify the value of our PTO policy versus another community's PTO policy, there's just so many different variables. I think it'd be tough to quantify an exact dollar amount.
Well, my concern is if we don't do our due diligence, we're going to end up with nobody here. Everybody's going to go to all these other places, and then they're going to find out the hard way, if the insurance went up or went down. Thing is, once they leave, they're gone. We want to keep the people here, don't we? So it's all about retention and continuing to develop. So we really need to do some more due diligence than just, okay, this is it. We've got to have more to explain, because on the other end, if you're the employee, you're going to say, okay, you're just taking money away from me. I need to understand more. Okay, I go through this, or used to go through it every year. Okay, what's it going to cost me? And when I've looked at other jobs before I lost my job, I had someone offer me a much better salary paid job. And I started asking the questions about salary or all the benefits. Ended up, it was going to cost me $10,000 a year. Not everybody's going to do that research. But I'm saying is we need, as we're going to make changes, as we have to, we're going to have something in place. And the other thing I noticed when I'm looking is like, okay, we started having issues. We've, gone up, what, 30%, 40% in the amount of people that we have? We've gone from 61 people to 88 people. 88 people, the 20-something, it's probably firefighters? Are we charging appropriately the other people for our firefighters? Are we charging the other municipalities the right amount of money? We might be paying them to go help them.
They're being charged. I mean, everybody,
But my point is what's the cost? We've added 20-some people, and I'm not knocking the firefighters at all. I'm just saying that we've had increased cost, and are we charging the other municipalities appropriately to cover the cost?
yes, they're being charged their proportionate share of personnel costs. Yes.
Does that include the insurance?
Yes, it does.
With this large amount of money?
Yep.
So then why is the number flipping the way it is? And we've gone from
From the amount of claims.
correct.
Right.
We're sitting here, now we're sitting here.
Because medical claims have gone up.
So
significantly.
then we have to account for that. And that means going back and saying, hey, guys, it costs more to have this.
But that is factored in. That's the point. It's like they get charged. We have basically a plan cost that's calculated based upon not only the administrative cost of it, but also the actual medical claim cost. So there's like per person, there's a charge for that. There's a charge for that value of that plan, basically. They get charged their proportionate share of that, the insurance cost.
Is it enough? I'm going to say no, just based on what I'm seeing. We should be looking at that too. Now, if we're going to charge our employees more, then we need to look at,
They would be.
we need to make sure that's accounted for, because it then affects how much we're going to charge everybody.
But the point is, they're already paying their pro rata. So we have the agreement every year as to how we're going to allocate the share of both fire and EMS costs. There's that breakdown that they've agreed to pay, whether it's 20%, 30%. They're then paying 20 to 30% of the personnel costs, and that personnel cost includes the wages, includes all the benefits, and includes the insurance. So they're already paying their fair share of those costs.
I think one thing we should consider maybe in tackling this task is maybe doing a little reverse engineering. And this is what I propose. Is anybody at all interested in going to the state plan?
No.
No. Okay. So we're taking that off the table. Does anybody think it would be a better choice to go to a completely different plan versus remaining self-insured?
Not based on what I'm seeing.
I'm with you. You guys agree, disagree? I mean, again, we're not putting anything in stone right now. I'm just trying to whittle down the options. So it looks like a potential solution would be stay with being self-insured, and then somehow, some way, we've got to make up for the costs that we're losing, yes? Everyone agree? So rather than give them a totally different plan, that means you got to drive to Muskego when you used to go into Elkhorn or whatever, stick with what you know, but because we've been upside down since 2016 was the last time we adjusted them?
They adjusted.
I mean, where we were more close to being flush.
Yeah, I mean,
Yeah.
2019 was.
Or 2019, I'm sorry. So 5 years. So that brings us to, okay, what are we going to do to make up the difference? Because something has to change, yes? We're all in agreement. We can't leave it the way it is. Okay, so that's off the table. We're not going to just leave it status quo and keep losing money and going upside down, so that's off. So again, reverse engineering it, what can we do to keep our employees? No matter what we do, they're not going to be happy because there's going to be some pocketbook impact to them. Whether it's a copay or a premium increase, or we say, guess what, you're covered, but your family's not unless you're willing to pay the difference, which is one of the things you proposed. No matter what, they're not going to be happy because it's a benefit that, in the eyes of some, we're taking it away from them. And to your point, they're going to say, what do we get back in return? I'm not saying I have that answer yet, but I'm just saying at least to, sieve it down and whittle it down, stay self-insured, figure out a way to make up the difference to get us closer to flush. That's where I'm at. You guys agree?
Agree.
Yep.
So,
And you know, when we started this, I don't think we had, certainly, we've been surprised at just how expensive some of the plans are that other communities are paying for, and honestly, the lack of providers. I mean, I think, you know, we were initially, when we started doing this research, you know, we really had, you know, every option on the table as far as going to the state plan, going to a different private, you know, fully insured plan. But to the points you made earlier, our self-insured plan provides a lot of benefits for us. We have more control over it. It's easier to manage the costs. So it makes sense to stay with that self-insured plan. But then it's the, you know, how do you, like you said, how do we break even? Because we're not breaking even. And it looks like next year's estimate is about $80,000 as to what they're estimating that increased cost is going to be, which is positive because we've been averaging an increase of almost above $200,000. So $80,000 is, and that's again preliminary, so they could always change that, but it's, you know, not as, let's say, as big of a hurdle as we initially feared. But then again, our claims have been looking better this year than they were last year, because last year they were so sky high. But then at the same time, we know some claims that are high have yet to be processed, so they may not factor into the premium we get for the next upcoming year, but then would be factored in the subsequent year. So the other thing to keep in mind is, even though, yeah, let's say we're looking at trying to, how do we cover $80,000 of costs for next year, approximately. Well, the following year they could raise the premium up, you know, the cost could be up $300,000 because there's sort of that delay, and when the premiums get factored into, or when the claims get factored into the premium we get charged from our, you know, third-party administrator and then the stop loss carrier. So it's just, so right now we're looking at the 80,000 as the target, and, you know, your ideas for how to address that, I mean, that's what we're looking for.
how crazy would it be administratively, and I'm just throwing this out here just to see if it'd stick, to offer them some type of à la carte where they could choose, I choose to opt out, give me my $30, I'll stay on my wife's insurance. Or somebody else may say, I want to include my one kid that I have, I'll pay an extra $100 a month to add my kid. Could we do something where they could à la carte it like that, or would it be just crazy to try to administrate that? I think people are more empowered when they have more options.
And that's one of the reasons that we provided that as an option on the estimated cost savings slide that Casey put together, was because the thought was, okay, if effectively we say, look, we're going to cover 100% of an employee's cost, and then if you want to add more people, then that's your decision. Because part of the challenge we have right now is that because there's zero cost to the employee, we are carrying every single family member, even when people are eligible through their spouse, you know, their spouse.
Right, well, why would you not?
Right.
I mean, you do it too.
Right.
I mean, we all would.
Yeah, no, absolutely. And so it's understandable, and certainly it's a benefit to the employee, but as a result, some of those claims probably should be covered through a separate health insurance company if the spouse is covered by a different
Exactly.
company. So the thought is, if you, as you said, have an à la carte option, which is, hey, we, the city, are going to cover 100% of the employee. It's your choice whether you want to go, you know, add dependents through us, or you want to use a different plan elsewhere. That is an option, and something that was.
I would assume that the people that are married with children, some of them may opt to just, like, it's not going to be, it would be, let me see if I can explain it this way. There's a family of 5. One person works here, one person works at Muskego in some factory. They have insurance offered there, but they say, why should I take it? I'm covered under yours. So even if this person now is told, hey, your dependents, including your spouse, are going to cost you X amount, the husband or the wife over in Muskego could still opt into their own insurance program. So it's not like they wouldn't necessarily be like totally not covered. There'll just be an additional cost involved to them. So,
You know, and I can say that, you know, for when I was, my insurance, I was single, was this.
Right.
But as soon as I added the spouse,
oh yeah,
it went through the roof.
right. And
Yeah.
that's the way it is everywhere.
Right. And, you
Yeah,
know,
whether your family is one spouse, is your one dependent, or if you have a spouse and 6 kids, it's still the family plan. So, like I said, is that crazy to try to see, you know, there's going to be a change. I'm envisioning a letter going out to the city employees There's a change that's going to be made. Here's the reason why. These are your choices. Option A, option B, option C. Versus, here's the change. It goes into effect July 1st. Deal with it here. Pass it out to all your employees. And again, if it's not feasible, if you tell me, Scott, it'd be a nightmare to try to decide which plan and which a la carte, then tell me so. If there is a way that we could do it where they can choose, for lack of a better term, the lesser of the three evils presented to them, can we do that? And will that cumulative effort make up for the loss and get us closer to being flush, or would it not?
It would, and that's part of the reason that that's on this item. Please, Casey,
Yeah,
let me
I don't
if
know if, so as I have this slide laid out, their options would be employee only, so they'd have no premium if it was just themselves.
Right.
Employee plus their spouse, so that would be a cost for just them and their spouse. Employee plus children, so that would be without the spouse. And then a full family, like you said, would be the highest cost. So I don't know if that's kind of what you meant, or if you were meaning less than or more options in addition.
So again, the quote unquote worst case scenario would be an increase in a $50 increase twice a month. So about $1,200 a year, they'd see an increase. Because you're saying every pay period, twice a month, right? For my employee and my whole family, the increase would be $50. Am I reading that right?
Under the 2.5% of expected cost plan, which would generate approximately $76,000. Yes, that's correct. Yeah.
So $100 a month is what they would see in real $1,200 a year increase. And you said earlier that 3%, what you were doing for Delavan, turned out to be what per check?
It's $3.50 per hour
Yeah.
for the family. I mean,
So
that's assuming that's using the highest.
Sure.
But still with it, yes. Yeah.
Can I ask a question?
sure.
Is there any, because I know the government likes to tell us what we can and can't do. Like is there something that we are required to do for the employees? Like they can't just opt out and get paid if that's an option we give them, because according to the government, we have to have health insurance. Like we want to make sure they're aware that like they have to have coverage. If they don't have other options for coverage, they are supposed to cover their family. Like they can't just kick off their kids and their spouse because they want to.
Yes, so if they, I mean, during open enrollment, they can make a change. They can remove their spouse or dependent child, and they don't have to have a reason for that. And with that, those 1095Cs that we send out every year that show that you have, that are proof of your health insurance, those used to be, that was required. I mean, we still have to send those out, but they're not getting imposed any fines or anything for not having health insurance anymore
Okay.
at this point. That's always subject to change, right? Under new administration, I don't know what that will look like, but as of right now, that's not a problem, so.
Okay.
But to Alderman McClory, your question, no, it would not be difficult to offer the menu of options up there. It would not be difficult to do that. So.
Actually, I'm on board with what you recommended, Scott. I like that. You know, it's a self-decision then.
Right.
It's not being forced, but here's your options.
Right.
And I apologize, I'm speaking from somebody who was in the military for 22 years, so I didn't have to deal with all of that stuff. My insurance was always covered, and it still is now that I'm retired, so I have very little, if any, cost I ever have to pay out of pocket. So I've got to defer to the people who had to deal with this for years, and how you feel about it, and what's your reactions to how you've had to deal with problems and issues.
Can you go back to the slide where it was comparing all the different municipalities? Because I want to just check something. Because what we're potentially proposing is about a $1,200 a year increase, yes? With that 2.5% for the whole shebang, if you want you and your spouse and your kids. So compare that to trying to figure out which one of these columns would apply. The EE plus
So
family?
the full family
The family.
column,
So,
yes.
and these are monthly premiums, so they're all
Correct.
paying $230, they're all paying Still well above what we would be recommending.
So the average is 247.
Right, that's what I see at
But-
the bottom.
But their salary is also less, so what's
Right.
247 divided by 160? It's $1.50 an hour. People gonna leave for $1.50 an hour more?
I guess it depends on what you make an hour,
Correct. Mhm.
whether you're making 45 an hour or you're making 20 bucks an hour.
And would you, again, I'm just trying to put myself in an employee headspace right now. Would I rather pay $600 a month, but I can only go to Freighter in Milwaukee, or pay $1,200 a year, but I can still go to Mercy Walworth or go to Aurora or go wherever, where me and my family been going since I started here 20 years ago. The convenience, you know what you know, you already know your doctors, your nurses, your PAs, your pharmacy, your Walgreens, whatever. That's already built in if we stay with the current plan and stay self-insured, which it sounds like we're leaning towards recommending that to the council. Am I misinterpreting that? Okay. So how do we get there? I think that, again, A, B, C, D. A just employees remain zero, but it's only covering you. For the 22 of the 88 people, it's not going to affect them at all, correct? Because they're one person, right? And then do we have any idea how many of the 22 people are married and have how many children, I assume? There's got to be a few people that are married and their kids are either out of the house already or they just don't have children. So that's another chunk of people that are, it's going to increase them a little bit, but not as much. There you go.
I have this in my notes.
Thank you.
Sorry. We have 12 that are just employee plus spouse, and then 10 that are employee plus children. So full family, we have 43.
Yeah.
Sorry, that's not on the slide. It's
No, it's okay.
It's, slide, I think, 12.
And I'm just throwing this out there as another option, if, we can still offer the menu we're talking about here, reduce the premium, but modify the HRA, so rather than having a HRA payment of $1,000 per family, if you scale up, if you basically do a 500 for every employee gets $500, and then that's gonna save $32,000, and then if we wanna cut the savings of 76,000 in half, we could further modify the premium percentage down.
Yeah, I was gonna bring that up if you standardize to the 500 versus the 1,000, then you can lower that out-of-pocket premium as well. Kind of split the baby, so you're getting something in lower than that.
What happens if you remove it completely, the HR?
76 is the last one on
How many people currently take us up on the HRA?
Anyone that's enrolled in the plan is enrolled in the
Yeah.
HRA, so all
Everyone
88,
gets it.
yes.
Okay.
So it's 76.5 if you take out HRA altogether, right?
Yes.
And we're talking about short of 80,000
Yes.
this year?
But if
again,
you look
that's
at
an
that,
estimate.
but if you look at that same slide in the bottom of the premium savings, we're looking at 76,000 if we go to 2.5% at the premium, right?
Yes.
So between the two of them, that get us 140 in the black? Yes?
60 in the black because they're short 80.
Oh, we already short 80 to start. Yeah, that's right.
Right.
Okay.
So if we just remove the HRA and get aggressive with our provider, make up $4,500, we don't have to create any premiums.
The one downside of let's just say removing the HRA and relying on the HRA is that it doesn't necessarily solve the problem of us basically providing health insurance to basically having more people on our health insurance plan than we probably should, because we're still going to be carrying everybody who may be eligible for health insurance through their other employers, their spouses' employers. So I'm just throwing that out there as, if you're trying to reduce some of the costs, because we know some of the, to be frank, some of the high claims we've had have been on spouses, people who aren't the employee, so who could have otherwise been covered through other plans. So that's the downside of eliminating the HRA, is that we still may be taking on more enrollees than probably we should, in fairness.
So if we go down the road of the 2.5%, with the employee only 0, employee and spouse a percentage, employee and children, employee family, leave the HRA with 1,000 for family and single at 500.
Would that be enough of a savings?
That's 76 grand.
No, I know that, but you already said we're in the,
We're short 80, so
Right.
we're short 4 grand
right, for this year.
for this year.
Maybe we should, if we're gonna, again, I'm speaking metaphorically, I guess, if we're gonna rip the Band-Aid off, should we not consider doing the 2.5% and the à la carte options and some kind of an adjustment, but leave HRA still available to people? Maybe they don't get 500 and 1,000, is that what it is right now?
Yes.
Yeah, maybe they don't get 500 and 1,000, maybe they get 400 and 800, but they still have some HRA there versus just, we're taking that all away from you and you've got to choose these other options. Do we need to be that, do we need to do both? I mean, I'm trying to be as sensitive as possible to taking the HRA completely off the table and making them say, guess what? We're not paying for your kids or your parent, well, maybe in some cases, but your dependents. Versus you will have HRA, but we had to crank it down a little bit, but it's still there for you. You're not getting 500 and 1,000, you're getting whatever number you guys come up with, you and Corey and the math people in the room. But we're not taking it away completely.
And
And that's why we tried to give you, we're not proposing to do both. This was sort of these are an à la carte, if you will, of different savings options.
Right.
Trying to show you how much we save by each. So we weren't proposing to do, eliminate the HRA entirely and to impose a premium. It was,
Right.
hey, these are just different options.
if we do need to do both, they do go into effect at different times though, right? Because if we change the insurance, that has to happen as of 7/1, because that's when our plan year starts, but HRA is January 1.
We would,
I did not know that.
we budgeted this year, the proposed changes for charging a premium, we wouldn't start until January 1 of next year.
Okay.
Yes, it's true that our plan year does start July 1, so technically, you're gonna have half a year of potentially, the increase, expected plan cost, but you're talking half of that 80,000, so you're talking about potentially $40,000 increase over the course of the 6 months. But that's one of those things, I guess, in fairness to the employees, and when we budget for the year, we budget for the year, we don't budget till, July 1, so, that would take effect January 1, so.
Okay.
So if we do the 2.5% premium with the savings of 76, and then we do the reduced HRA that you propose in the middle of the screen there, that'll save us 38.2. Will those two numbers be enough to cover us, to get us closer to being flush, at least for this year? Not knowing, what, claims we're gonna be getting next year or the year beyond, whatever. Would that be enough?
Yes, I mean, again, our goal is 80,000, so.
Right.
Those two together would be, closer to, a little under 120, but.
Yeah.
What do we do then this time in '25 before the 7/1 renewal? If we get a $300,000 increase, are we right back to where we're sitting here today? Again, if we make those changes, then we've got to come back and figure out, make more changes next year.
And that's why I think that middle option of reduce HRA now, plus the 2.5% is our best bet. Gives us a little bit of cushion. It still won't, potentially prevent what you're saying. They might be looking at it the same thing.
I think if you went with the top one, though, of 500 across the board, it's still $32,000 in savings, 32.5.
Right,
So regardless, it's $500, period.
right.
So, and then, then the 2.5% for the spouse, children, and family.
Is anybody at all interested in removing HRA? I'm not.
No.
Okay. So how much of a reduction of the HRA along with the 2.5% do you think is reasonable at this point? Because I mean, one is 32,000, one is 38. What, I mean, it's only $6,000 different.
What just
but to-
standardizes it?
Huh?
If I'm single, I get $500. If I'm family, I'm still getting $500.
Right.
So it just simplifies it versus,
No, you'd be getting 250.
well, I'm still saying if you just.
Oh,
go
you
to-
don't, you want the top up, the
Yeah,
top
if
one?
you just keep it simple, you know, again, because for the employee only, they're not gonna pay any more insurance, they're not gonna pay for their insurance anyway. They're at zero.
Right.
It just starts kicking in.
I'm okay with either one of those, but I just don't want to take it away from the employees. I mean, this is already going to be enough of a, for some anyway, there could be some serious, you know, sticker shock. And I'd want to minimize that as much as reasonable.
Well, and to Alderman Flores' point, I mean, because we are having to evaluate a lot of different options, and we don't know what the impact is gonna be. So hypothetically speaking, if you move forward with this menu plan, and let's say you have 10 employees, I'm just gonna make, let's say you have 10 employees that shift from a family plan to employee-only plan, or employee plus spouse, whatever that might be, that's obviously gonna change the cost of our plan for the city as a whole, which then is gonna, to Mayor Schroeder's, question point about, it's gonna impact the renewal for next year, such that maybe we see, some savings, and so, I guess, rather than, I guess I don't say hope, but my thought was that if we do a incremental, let's make, the change we have to at least cover our costs, see what happens in terms of what is the overall plan cost? Do we have some savings because you have maybe some employees who ought not to be on the family plan, or take advantage of health insurance to other providers? That could then save the city money next year and in the future, such then you're not necessarily facing a $300,000 increase. Maybe it's only 40,000, whatever that is. So because we don't know what's going to happen, I'd be hesitant to make drastic changes until we see what the impact is going to be of doing this menu option.
So your posture is to do the 2.5% a la carte options and leave HRA alone at least for this year?
Or to standardize the HRA and reduce the premium to half of the 2.5%, so it's 1.25%, just do half of it. So,
Yeah, because employee and family right now, at the 2.5% is 62 cents an hour. Now you're gonna be talking about 31 cents an hour, or 35 cents an hour, which is still not good, but.
Anybody else want to be heard?
Ask a question real quick.
Yeah.
Can you use your HRA to pay for the premiums?
No.
Do the majority of employees deplete the HRA?
We have a good number that roll over. There are, I would have to look. I would, off the top of my head, think it's kind of 50-50. Those that deplete and those that roll over an amount.
I just wonder if employees would, trying to keep everyone happy, if they would rather lose the HRA versus having to pay out of pocket. If they're not using it currently, it wouldn't be seen as, a loss if they're not using it.
Yeah, I was just thinking about this, is eliminate the HR like you're saying, but the employee only, still no insurance, no premiums. And then you can reduce the premium options for the other a la cartes, but taking the HR away.
I
Can we let the employee
question
choose?
about that.
Go ahead.
So for the people who have rolled over their HRA balance, that would be a benefit that they get to keep in a bank to use at some point. So I don't know. I mean, we'd have the savings of not paying people, paying into their HRA going forward, but we're still going to be paying out HRA funds to some extent. So just keep that in mind.
Until it zeroes out.
Right.
What's our current HRA bank per se? No clue.
I don't know that. Yeah.
Anybody know? Nobody knows? I was just curious how many people use it. I mean, I know people, when I was at the county, there were people that would always do it because they knew their kids needed LASIK or whatever. They would put it away and then draw from it throughout the year. But some people like me, I never used it.
And
A lot of employees using it, especially now that it's easier. I think it's easier to use now because you got a card. You know, we have the card through
Right,
Associated
right.
Bank, so it's a lot easier to do it than having to submit all the receipts and then Lacey's trying to figure out, you know.
This is another off the wall crazy idea. Could we give the employee the option to remove themselves out of HRA versus doing the 1 or 2% à la carte?
I think it could,
I have a lot of ideas, but not many answers.
no, I think it'd be tough from a budgeting
Yeah.
perspective because we're never gonna know.
Okay.
I mean, trying to keep track of that could be quite challenging.
And the HRA is like an HSA. Once the money is there, it's yours. It's not like an FSA where you're allowed this much per year, and once you put it in there, if you don't use it, you lose it.
Right.
Right.
It gets rolled over.
Yeah.
Right, the HRA is like an HSA where will roll.
It'll roll over,
Okay.
but when they leave, if they have any funds that they haven't used, they wouldn't be taking that
Oh,
with
so it's
them.
not theirs. It's there for them as long as
Yeah,
they're employed.
if they elected Cobra, they could continue to use it, but after they're off the plan, if they still have funds in there, they wouldn't be able to
Okay.
access those
Okay.
anymore.
I guess I heard we're not really making any of these changes till January 1st, so our timeline is stretched out beyond July 1st. We have time to get into this further.
Well, the downside is that, a couple things. A, if we want to, let's say, change our broker, we would need to do that quickly. The challenge too is we've got the police bargaining that we have to do, and we're already almost halfway through for that. So in order for us to, I mean, that's one of the things that was in the last bargaining agreement was obviously health insurance and what they have to contribute for premiums, if any. So we have to have an answer on that to be able
Okay.
to negotiate that. I know the chief is eager to move forward on that. Plus, obviously, we're gonna be starting our budgeting process here, the next month or two. So it's tough for us to, let's say, I'm just gonna say. kick
Wait
it,
till
like-
fall.
Yeah, wait till fall would be a problem.
Okay.
So. that's
So
actually why
when
we're
are you
not-
thinking, within May and June, we've got to have this put to rest?
Chief, I don't know if you got any comment
As
on
far
that?
as the time, I think,
Yeah.
yeah, the sooner the better, because I think we'll want to at least start meeting early summer with the association would be my recommendation, as long as the city administrator is okay with that.
Because then, of course, however that bargaining agreement turns out, is obviously gonna impact the budget as well, and we're doing it for, the fall, so.
I'm sure you guys have already talked to our broker about this, but are they doing anything to try to keep us and want our business?
There's been a preliminary willingness to reduce their, at least we've been told that there's a preliminary willingness to reduce their broker fee, so that might have some savings. So,
How long have
Right.
we been with them? A very long time.
Peter, I think we've been for 21 years.
Okay.
So circling back, we're going to need to, what was the magic word about the HRA again? Do something with an S.
Flat rate.
No.
Standardized.
There you go. We're gonna standardize the HRA and in concert with that, offer the employees, you said a minute ago, I thought you said if we sustain that, then we can do a 1.5%, not a 2.5% for the à la carte choices?
Is that validated, or is that just pull from air?
it's pulled from air in the sense that 5% would save us $152,000, 2.5% would be 76,000. So if we're saving approximately 32.5 by standardizing it, then we're looking for another approximately, I mean, yes, ideally we'd have, $50,000 in savings on the premiums to go with the 32 to give us the 80. But if, for simplicity purposes, if you're saying half of the 2.5%, or if you want to do an even 2%, let's say, which then would probably be closer to, maybe that's closer to, 55 or something. So we can calculate the numbers if we want to get an even 50 in premium saving, premiums, and then the 30 from the HRA to give us the 80. We can come back with a specific percentage if that helps.
I think that would be helpful. Do you?
Yeah, I agree,
I'd rather see hard numbers.
but in concept,
Right.
in order to get it to the full council, because apparently time is of the essence.
Mhm.
Do we have this in time so we can have another meeting prior to the 20th? At our next meeting?
May 6th,
Not the 6th, but
the 20th, yes.
the 20th, so we could meet again before then.
We have a legislative and regulatory on the 20th already at 4:30, so. And then we have regular council after that.
We can stack them if you guys are okay with that, or we could do
We
during
can-
the day.
I can do one during the day, yeah.
I can right now, subject to change.
When would you want to meet?
Anytime.
How long does it take to crunch all the numbers?
I honestly wouldn't take but like 60 seconds, because we'd have to just,
There we go.
Well,
Update my
You're on the
spreadsheet.
clock.
Just
You're on the
update the
Draft-
spreadsheet, so-
You're on the draft. Draft clock is running.
Yeah,
Spreadsheet here.
Okay.
It's on the computer.
if we could take probably a 5-minute recess.
yeah, let's take a recess.
Or,
Yeah, come on back.
Take
Take
turn.
5.
Everybody,
All right, we added a few more options here. So we have the 2%, which is the yellow, 1.75% and 1.5%. And then the total savings is, the estimated savings is at the bottom here. So 1.75% would hit that 50.
And that's what standardizing the HRA to 500?
that would be in addition to, that doesn't include the $32,000 savings from standardizing the HRA, that's just the savings from the premium. So, if you standardize the premium and if you standardize the HRA and had a 1.75% premium, it would generate that's $80,000 that you're looking for.
And you're standardizing at the 500? The 32.5? So make sure, because we've talked about a lot of different things, just want to make sure. So we're going with the standard single 500, it's 32.5. And then if you go to 1.5, it's now 45.6. Or you're going to 175? 175. So 1.75 is 53. That puts us at a little bit over 80, 86.
What do you guys think about that?
I think I would be comfortable forwarding that for action, for consideration.
Is that your motion?
Yes.
We have a motion. Do we have a second?
At the 1.75?
Yes.
Correct.
Yeah, second. With the standard 500.
Plus
Right,
standard
and the
500.
standardized HRA of 500. My only comment is, as much as I want to, I love that it's at 175, not 2 or 2.5 or 5. What happens if next year we're coming back again? If we skin the cat too lean? I know I'm mixing metaphors. I'm sorry. I'm very tired. If we tell the employees it's 1.75, but then next year we're right back again. Now we tell them now it's 2 or 2.5 or 5. Why didn't we do that the first year?
I'd rather readdress it next year.
I mean, I think 80,000, we're tight. We're trying to make up that 80, 70, whatever it is. So if we start at 175, we got nowhere to go versus starting at 2 or 2.5.
I don't want to take any more than I have to.
I don't either.
Oh, okay, again, but how are we going to
Well, if we got.
explain that to the employees? Is the cover letter or whatever, the email, when it goes out, it needs to say 1.75 was as lean as we could go. But if we're upside down again in 2025 or 2026, you may see a 2 or 5 or whatever. I think we owe it to them to tell them that up front.
So I have no problem.
You're good with
putting
that?
in.
I mean, because obviously the people that are in the gallery that are city employees understand this, but the person who's never going to come to these meetings, that isn't going to ever come to the meetings, they're just going to be given an email or a slip of paper that says, guess what, effective blah, 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 it's going up 1.5% in this. So I just want to be careful.
Well, then we're gonna have
Listening sessions?
an employee
Yeah.
information session where we explain what the change is, so.
Right,
To further
right.
reinforce that.
So I'm good with it, but understand we might be right back here again 10 months from now saying the same thing, saying, guess what, 1.75 wasn't enough. Right?
We might be.
Right, and maybe not. We may be in a much better position. Who knows?
Adam said, thought there was a lot of them that had family members that had that were cost increase on this. And you look at it, that really was just few years that it was totally out of what had been the norm.
Right.
And some of the employees at that time were getting older. There's gonna have expected.
Everybody gets older.
Yeah, and that's gonna help
Right.
raise costs.
No, I mean, and this is both a pro and a con, which is, you know, because the 1.75% is, you know, for a family would be, you know, $75 per month. I mean, it's still probably gonna be a better deal for the employees to stay on the family plan with us than it is the other. So I don't know how many people actually will drop off or not, so it's hard
Right.
to say, but.
But to your point, even if one person doesn't stay with our insurance and goes to their spouse's insurance, and that spouse's insurance is the massive coronary that costs us $380,000 next year, that's not coming off our books, that's coming off of the factory in Muskego, potentially, right? Okay. Anybody else? We have a motion on the floor to send it to full council. Any other thoughts? If not, we'll, go ahead, Joel.
Just, the only thing to Alderman Payson's point earlier, I think you need to let the employees know the hardship, because I think I think many of the employees, once they see you are now gonna charge them a premium, to your point, I think they're gonna feel that the door has now opened, so to speak. So I think whatever you're looking at, to Alderman Payson's point, you need to let them know that you're gonna take this into consideration of hopefully with the COLA or whatever else you're looking at next year, because my fear is that retention of quality workforce now that you have opened this door.
Okay. All those in favor of sending this motion forward to the full council, say aye.
Aye.
Aye. Opposed? Motion carries. Motion to adjourn?
So moved.
Second.
Stand adjourned.